Hi friends, welcome to the hair series. So in this series, we will be covering many videos on hair and scalp and will be trying to clear many of your doubts which you have had for so long. And if you still have doubts on something related to hair and scalp condition, kindly comment it in the comment box and I will try to make a video out of it and clear your doubts as far as possible. So today's video is about a very interesting topic which is a very upcoming disease when related to your hair is seen more commonly nowadays. That is alopecia areata. Alopecia areata, the name comes that you lose hair in a particular area in a bunch. Usually you lose it in shape of coins. So initially it starts as shape of coin or as a quarter and then gradually it coalesces together to make a big area where you don't have hair or your lost hair on that area. So let's see about why do we get this alopecia areata. The reason why we get alopecia areata is because alopecia areata is an autoimmune disease condition. Yes, autoimmune disease, what does it mean? A disease where your own body attacks against your own body's part or cells. For example, if this disease, if your body attacks against your hair follicles, then of course it becomes alopecia areata. And if it affects your skin, it can be vitiligo if joints, rheumatoid arthritis if scalp or body, skin again psoriasis. So there are many autoimmune conditions and among them one is alopecia areata. That is when you lose your hair in a shape of a quarter or in shape of a coin and you lose in a bunch. Okay. So in this disease, if you see, alopecia areata is got 4 types. The first type, that is alopecia totalis. That is you lose, initially it starts like this and then you lose most of the hair on your scalp. Second, Alopecia Universalis, where you don't only lose the scalp hair, but you also lose the hair on your body. So that's why it's called Alopecia Universalis. The third type, which is most commonly seen, that is Diffuse Alopecia Areata, where you may not lose in the shape of coin, but you may lose in different parts of your scalp, and by the time you have realized it, you would have lost half of your hair. So that is the third type. Then the fourth type, that is Ophiasis Alopecia Areata. In this, there you lose the hair in the form of a band, that is from here to here, like a shape of a band. That's why it's called Ophiasis Alopecia Areata. Now once we know this, what is the cause? Of course I told you autoimmune disease, but you have to realize that people with other diseases are at risk of having alopecia areata. Now, which group of people are at risk of having alopecia areata? For people who have a family history of asthma or who have allergy, thyroid complaints, pernicious anemia, Down syndrome, and most important, even vitiligo. Yes, because some of these diseases are autoimmune diseases, so naturally it triggers more autoimmune conditions. So once you get alopecia areata, what are the symptoms? Of course, as I told you, to lose a hair in a bunch in a particular area. But when patients lose, initially some of them may get tingling, itching or burning. But after you lose the hair, you may not experience any pain on that area. That area might be even smooth to touch. You may not get pain or burning or itching or any such sensation after you have lost the hair. But if you have had this condition, it is very necessary you treat it initially itself, because if it spreads fast or if there is any triggering factor like emotional stress or physical stress, then this disease may spread off very fast. You may lose a lot of hair in a very short period of time. Now, once you know these are the symptoms, then there is one more symptom that is very important, that is people who have alopecia areata might also have nail problems. Yes, they may have redness or pitting of nails, or the nails will become very brittle and thin and it just breaks off easily. Okay, so nail complaints also will be seen with the loss of hair. Now, who all get it, or like whether we get it in which area? Many people think you get it only in scalp, but I am seeing many patients or in many male patients who have lost their hair in round shape or their beard area. even on the chest. So wherever there is hair, you can have alopecia areata. Now, of course, that's one thing, but once you get it, what are we supposed to do? Now, this is a most common question I heard. So many patients are anxious about it because you are losing hair, and of course, it causes an embarrassment when you are going out. So, what do I do? So, the answer is plain and simple. I am a homeopathic doctor, and I tell you that there are many good medicines for alopecia areata in homeopathy. Now we take your full case and see whether what are the risk factors which brought you to this disease. Take with the holistic concept, analyze your full case. Then we go ahead with the treatment. A medicine which will correct your autoimmune disease and makes your body realize that of course it's my hair, please don't let it go. So that's how homeopathy works. Now in my clinic, there's a unique way that along with internal medication, we also give external treatment where the areas where you have the bald spots, the hair is made to stimulated, or the follicles are stimulated to bring on new hair, and it gets a like rejuvenation. Okay, so that's how homeopathy works so well in autoimmune diseases, and especially in case of alopecia areata, and you are having a high chances of getting your hair back. So with this, if you like my video, please like it, subscribe it and share it. And if you have any doubts like this or about disease conditions, please put it in the comment box and I'll make a point that I find an answer to your question. So stay healthy, stay safe. That's all for today. Stay tuned for more.